Government is intensifying its fight against HIV/AIDS head-on in FET colleges across the country. Well, the Department of Higher Education and Training launched its First Things First HIV, TB, STIs counselling and testing program at the Goldfields FET College in Welkom in the Free State. Speaking at the event, Deputy Minister of Higher Education, that's Mduduzi Manana, reflected on the recent research by the Human Sciences Research Council showing an increased number of young people having unprotected sex and, of course, getting infected. Well, for more on this, we're joined from our Pretoria studios by Dr. Ramnik Aluwalia, the Director of Higher Education and Training HIV/AIDS Program. Good afternoon, Doctor, and thank you for your time on the PM News Desk.
Good afternoon, Karshini. Thank you for having me here.
Doctor, this isn't the first program of this nature. What makes this one different? You did have similar launches last year.
I think it's historic for us because we first of all launching this program to the FET colleges. This was never there before. For us, these colleges are very vulnerable. The growth of college, as per to the white paper of the Department of Higher Education Training, is increasing at a very fast rate. We in fact had seen a 90% growth rate in young people joining FET colleges. And these are young students from the age of 15 onwards. They're very vulnerable. As soon as they come to college, they see this unbound freedom that brings them vulnerability to HIV and AIDS. Similarly is the case with lots of alcohol and drugs inside. So this First Things First campaign which we launched is a fight against HIV, AIDS, and as well as other epidemic drivers that surrounds the disease, surrounds TB, surrounds STIs within South Africa. And I think our aim is to have these young people know their statuses, look after their health, because that's our next economy in this country and we want to protect them.
Doctor, there is something worrying emerging from the HSRC report in that it does show an increased number of young people having unprotected sex and, of course, getting infected. Now, they do appear to be relying on the fact that there's ARVs and that should be available when they become infected. How do we get around this dangerous mindset, Doctor?
See, the point is HSRC survey has clearly indicated the amount of the number of population that is very vulnerable in South Africa is 15 to 24. Second is women. Third is locality, people living in low socioeconomic statuses. So these are all the vulnerabilities that has come out of the household survey. And that's all surrounds under the college scenario. We have people under the age of 15 joining the colleges. The condom uptake has decreased tremendously. They are prone to alcohol and drugs. They are prone to transactional intergenerational sex. They come from very low socioeconomic status. Most of the colleges are in townships. Most of the colleges are in rural areas. So this makes the environment very vulnerable. And this is where, as a medical science says, this is a time when a person gets puberty. This is a time when you see your sexual experience for the first time. This is a time when you are at risk to having those vulnerable factors that cause HIV and AIDS. So I think that's where the household survey of HSRC has been trying to emphasize, and exactly that's the exact area where the First Thing First campaign is trying to address the issues that lead to HIV among young people.
Doctor, have we let our guard down somewhat in that people are living longer on ARVs, but there's still a critical need to focus on prevention as well?
See, definitely. I've always said this. I'm a medical doctor in the first case. HIV is just like any other chronic disease. Say, for example, you have diabetes or you have hypertension. You have to be screened. You have to know your diabetic or hypertensive status as early as possible so that you can be put on treatment. Now, what will happen is if you do not know your diabetes and hypertension, you'll end up in having a stroke or a heart attack, and you probably are more prone to dying. Similarly is the case with HIV and TB. We need to know the status early. As soon as you know your status, there's care and treatment. You look after your nutrition, you look after your diet, you look after your care and support, and you can live as long as you want now. This medical science is changing. Medical science has proven that if you look after yourself with HIV, 30, 40 years of life has been possible. and this is what the country needs, this is what the economy needs, this is what your family needs. So I think when people are living longer, this is what exactly the nation wants. We want to pay people to live longer, live healthy, and treat HIV as any other chronic disease like anything. And for us, these young people who are starting at the age of 15 onwards, if they know their status, it's fine if they have been exposed to HIV, but if they know their status early, we have a very sound life for them. See, for example, it's a cycle. You have a young guy, you have a young lady who becomes pregnant, delivers a child, the child becomes orphan and loses her mother because of HIV and AIDS. But just if you imagine this mother could have taken that treatment and lived for another 30 years, this child would have not been orphaned. The same child would never be HIV again. So the cycle is broken if immediately we know the person's status, if the person can look after themselves and can survive longer and healthy.
Yes, Doctor.
Contributes a lot to the country.
Doctor, like you're saying, in order to beat this HIV/AIDS, we need to convince people on the ground to reject the stigma, take responsibility, and of course test to know their status. It's a necessary step to accessing treatment. But are the campaigns you're taking to the people gaining the desired momentum in that regard?
I must tell you one thing, that the campaign I run, First Things First campaign, was evaluated last year through pharmaceutical companies, which was one of the partners here, as well as the US government. It clearly indicated that the First Things First campaign does speak to the students. It does allow them to go and know their status. Colleges and universities are environments when a student sees another student testing and he wears a band, like we give them a band saying, oh, I got tested. He says, okay, even I can get tested. It involves youth dialogues. It lets to people speak about them. It makes them know that HIV is not a very difficult disease. It is a disease which still has a treatment. It is a disease where you can still live longer, which you can be very productive. So I think we have to continue engaging in campaigns. We have to continue mobilization. We have to continue sending messages which are absolutely appropriate for people to understand that HIV is not to be stigmatized. It is a disease where you can still have treatment, where you can live longer, you can live very healthy, and you can protect other people around you for not having HIV and AIDS.